Okay, well, as we talked about, President Obama, he's trying to reform the health care system for the first time since President Clinton's ill-fated attempt 15 years ago. So what has changed since then, and what lessons can Obama learn from Clinton's mistakes? Well, Donna Shalala was at the center of those efforts as President Clinton's Health and Human Services Secretary for 8 years. And the Secretary, Shalala, is now the president of the University of Miami and joins us now from the sunny city there in Florida. And thanks so much, Secretary Shalala, for joining us.
Happy to be with you.
Okay, so tell us essentially what has changed in terms of the fight for health care since your efforts back in the early 90s?
Well, what clearly has changed is the situation has gotten worse. It's gotten worse for business in terms of the cost of health care. Larger and larger numbers of Americans have lost their health insurance. A combination of cost and coverage issues has forced us for the first time in almost 15 years to confront the fact that we have to have health insurance for everyone, and it has to be affordable and of the highest quality.
And yet, of course, as you just heard from Juliana Goldman, there's certainly a lot of obstacles in the way for President Obama to try to get these health care reform proposals through Congress and enacted. In that sense, then, is there a risk, then, that these reforms could be so compromised that they don't resolve the issues that you talk about, because the situation is far worse than it was a decade ago?
I think there's a greater risk in not doing anything. The fact is, our businesses cannot compete with the heavy burden of health care, particularly as our costs are going up, and we cannot survive as a nation with increasingly large numbers of people who are working every day trying to support their families who have no health insurance. The fact is, those that don't have health insurance are getting some health care, but they're getting it late, and those costs are shifted to the rest of us who have health insurance. One way or another, we're going to pay for it. We either pay for it in an efficient way, right, with fairness to all, or we simply end up with a catastrophe, in my judgment, in terms of the quality of Americans' health.
Right, but Secretary Shalala, maybe I'll ask this question again in a more succinct way. Is the reform that we're talking about right now going through Washington, is that going to address the problems that you detail at this moment?
I do believe they will. They're talking about two problems they want to address. One is coverage, and the other is cost. Cost has two dimensions to it. One is paying for the coverage for those that don't have coverage, providing subsidies. The other part of cost is slowing down the growing cost of health care, getting the inefficiencies out of the system, moving towards a good standard of care for everyone.
Okay. What do you think, though, in terms of the compromise that's going to have to come out? What's going to have to be given up?
Well, you can't tell yet. I think we're all going to have to pay our fair share. And the conversation about taxing benefits is going to be a serious one. After all, we're only talking about taxing the Cadillac part of our benefits. That affects the wealthiest among us, not the poorest among us, not the average American who gets health care through their employer. It affects the people that have very high cost, very expensive plans.
Okay, Ms. Secretary, very quickly, what could sink these efforts this time around?
I think ideology. We've got to get over our hang-ups about this is the way conservatives look at it, this is the way liberals look at it. We cannot have a single-payer system. People like the health insurance they have if they have good health insurance. We have to protect that. So somewhere in the middle, there's a compromise, and it looks like the Senate Finance Committee is working through that compromise.
Donna Shalala, thank you so much for joining us on the health care reform.